After your surgery, you'll usually be provided a number of medications. These will include a nasal ointment cream, a nasal saline rinse, and a course of antibiotics in some cases. You may also be provided some nasal steroids that can be applied with a spray or tablet steroids to take. Painkillers will also be provided. Please take them as prescribed. Remember to take all of your medications and follow the advice that has been provided. This will help to make your recovery smoother, more comfortable, and help prevent post-operative complications like excessive crusting, bleeding, and infection. After surgery, your nose may be packed with a dressing. This means you will not be able to breathe through your nose. It will leave you with a dry mouth. The packs are usually dissolvable and will dissolve after a few days. However, we may sometimes need to use non-dissolvable packs. If this happens, you will need to spend the night in the hospital and have them removed the following morning. Please expect a small amount of bleeding after the surgery, which will usually stop after a couple of minutes. If it lasts longer than 20 minutes, then you must seek some medical advice and help. There may be swelling in the nose after your surgery. Your symptoms may even be worse than when you came in. This can be quite normal. It usually takes 2 or 3 weeks for the swelling to go down and for you to notice a significant improvement after you've had any sinus surgery. You will find that your nose will feel blocked for several weeks after the surgery. There will be some blood-stained discharge and congestion from your nose for 2 to 4 weeks. Again, this is quite normal. You will not feel the full benefit of your treatment for about 2 months after your surgery, and you will need to take the medical treatment that has been provided for you to gain the maximum benefit. Bruising and swelling of the eye is rare. If you have swelling around your eyes, this is an emergency. If your eye becomes very painful or the swelling increases, please contact us or the hospital directly for more advice, as you may require treatment urgently. After the operation, it is normal for your nose to feel a bit tender and for you to suffer a mild headache. The congestion and the discomfort can last for the next 2 to 3 weeks until all the swelling internally has settled down. You will be given some painkillers to take home. Usually paracetamol and codeine are typically provided, and ibuprofen is also used when needed. There are a few things you should look out for: persistent excessive smelly discharge from your nose, a feverish or unwell sensation, or if you find your nose is becoming increasingly painful and your current painkillers are not relieving the pain. If you get any of these symptoms, you should contact us immediately for more advice. If an infection is not treated, your nose may start to bleed and could negatively impact the outcome of your surgery. For the first week following your surgery, you are advised not to blow your nose or pick off any of the crusts, as this may interfere with the healing process in your nose and may start your nose bleeding. If you need to wipe your nose, use a tissue rather than a cotton handkerchief, as this reduces the risk of infection. Try to avoid very hot baths, and we suggest you drink warm instead of hot drinks for the first 48 hours after surgery. Drinking hot fluids will dilate the blood vessels in your nose and increase the risk of bleeding. Try to avoid alcohol if you can for 2 weeks after the surgery, and avoid taking aspirin unless this has already been prescribed for you. Try to avoid sniffing or sneezing for 2 weeks after your surgery, and if you do need to sneeze, try and sneeze with your mouth open to help lessen the pressure forced through your nose. You need to take care not to knock or bang your nose. Contact sports or any strenuous activity should be avoided until your nose has completely healed. If your nose starts to bleed, do not panic. Try to rest in a sitting position with your chin slightly down. Use a cloth or tissue to apply firm pressure to the fleshy part of your nose, and use a clock to time yourself. Apply this pressure for 10 minutes continuously. Suck on an ice cube and apply an ice pack or a packet of frozen peas to the back of your nose or to your forehead or back of your neck. Try to spit out the blood and try not to swallow it, as this will make you feel unwell. If you're unable to stop the bleeding after 20 to 30 minutes, go to your local emergency department. Avoid any smoky or dusty environments for the 2 weeks after your surgery, as they can irritate the inside of your nose. Try to stay away from people who have colds or chest infections, particularly in this period, as if you catch an infection, it can affect your healing. Try to sleep with your head up on 2 or 3 pillows for the first few weeks after your surgery. This will make things a bit more comfortable and reduce the swelling and the drainage within your nose. Your nose may feel blocked for several weeks, and this can be caused by crusting or clots inside your nose. Clearing this away with the nasal saline rinse will help to prevent an infection. Use the nasal douche that has been provided, or obtain one over the counter like Neilmed sinus rinse or Sterimar nasal spray. Make sure you follow the instructions provided, and it's best to do the douche at least 3 times a day to remove these clots. Continue with this until you're told to stop doing this at your follow-up appointment. Occasionally, splints or sutures can be placed inside the nose. Usually they are dissolvable and will dissolve in a few weeks after the surgery. If there are non-dissolvable stitches or splints placed inside the nose, these are usually removed at your outpatient appointment, which will be scheduled 1 to 2 weeks following your surgery. All patients are advised to take 2 weeks off after the operation to recover before they return to work. If you need a sick certificate for your employer, one will be provided for you on your request. Remember, this period of time is to allow you to rest and recover and recuperate after your surgery so that you gain the maximum benefit from this operation. If you have an external dressing or splint in your nose, you will be asked to attend your outpatient appointment 1 to 2 weeks after your surgery to have this removed. Otherwise, the first post-surgery follow-up appointment is usually at 6 weeks. This will be given to you either before you leave the hospital, or this may be emailed to you afterwards. If you need any more information, please do not hesitate to get in touch with us.